Well, good afternoon. I think we have a quota now to start the grand rounds. It is a pleasure always to come as an original pediatrician to the medicine grand rounds. We are privileged that our specialty is not a subspecialty. It is for all ages. And thanks, Dr. Levine, for inviting me to your department. That actually I'm a member of your faculty as well. So I choose a topic that usually exciting to the public as well as to the media. Food allergy in general is just a nice thing, people to talk about. They even in parties and around dinner, they talk about food allergy, but they don't talk about colitis and heart disease or mental illness now. But food allergy is a nice thing. And when they ask people by surveys, whether written surveys or by telephone, do you have food allergy? 20 to 30% of the replies say yes. When studies are done to confirm that's the true food allergy, it comes out in adults about 2% only, and in children about 4 to 6%. So far less real food allergy than what people claim about. And when people talk about food allergy, they talk about eating food, then they get undesirable reaction, whether it is vomiting, diarrhea, colic, or acute urticaria, acute angioedema, wheezing, or even anaphylaxis. That's what I talk about. I'm not going to talk about this type. That's many people, even the public, will know about it. Say, when I eat that thing, I get that reaction, I'm not eating it. That's easy. Although many of the food allergies by ingestion are not easy to discover. But I'm talking about this type. And this is just part of email that I get. I grabbed a handful of mixed nuts from a can, and immediately my throat felt like it was burning and itching. Within a few minutes, my tongue began to swell. I started having difficulty swallowing, and my entire body was itching horribly. My friend rushed me to the emergency room. I received several medications intravenously, and the reaction resolved. This patient did not eat the food, it just touched. Whether this is by touching or by inhalation, we don't know from that email. But first, do we believe that a person can just touching something or smell something ends up to the emergency room with a life-threatening reaction? Another one, and this lady, this is just a small part of the lengthy email that came from her. I don't know how they get my email, the people from all over. But eating shellfish causes swelling of the lips and throat, cough and chest tightness. During the past 9 months, I had same symptoms in places where seafood is being cooked. While walking down the hall at work, I had sudden chest tightness and cough. Found out later that someone had microwaved shrimp nearby. Since then, I had reactions when someone has entered my home and had previously been eating a seafood restaurant. Boy, doesn't she need a psychiatrist? Isn't that what we say? Can this happen? Actually, a few years ago, one of our employees in the hospital was referred to me by employee health because of the first part here, microwaving shrimp, and she didn't know, and she ended up by laryngeal edema. Again, this. So we believe these things and many of that stuff. So how can food cause allergy without eating? It can be through the skin or the mucosa, through the respiratory tract by smelling, or in a hidden way, hidden in a food, another benign food, or in a nice medication. It can be in the exclusively breastfed infant through the maternal diet, come out in the breast milk. It can be transplacental even, and it can be by a nice life-saving procedure of transplantation. And this is what I will focus on now. We'll start with by touching. Touching or kissing or putting dermatologic preparations that Dr. Carrington writes a lot about. It can be, the touching can be occupational, with many occupations, or non-occupation any place, and can be direct or indirect. The manifestations by touching the food may affect only the skin, either immediately, contact urticaria angioedema within minutes, irritant contact dermatitis, that's after chronic exposure and cause irritation, then every time you touch the food will do it. Phototoxic contact dermatitis, or a rare condition, protein contact dermatitis. Can be delayed, the allergic contact dermatitis, which involves cell-mediated, that's why it will take 24 to 72 hours, and it can be localized at the place where the food touched, or can be systemic after ingestion. After the person becomes sensitized through the skin, the T cells can move around the body, and when the person eats the food, it will go, and although the person did not touch the food, but will get systemic contact dermatitis, which is oxymoron. Systemic, but contact. And this can be confusing. The manifestations by touch are not limited to the skin. It can be in the respiratory tract, which is just puzzles. It can be just cough, sneezing, or wheezing, bronchospasm, or even anaphylaxis by just touching the food. And I'll give you a few examples, some of them of series and some individual selected cases. This is 64 fish processing workers compared to 60 controls. A skin prick test to buy 8 seafoods were done, and if it was positive, even went to for a blood test for a specific IgE. The sensitization by, if both tests are positive, to at least one of these 8 seafood happened in more than 1/3 of the workers, but only in 10% who are not working with fish. So definitely exposure by skin or by inhalation can sensitize, and some of them, not just to be sensitized, but they can get symptoms. 6% had work-related symptoms. In a large series of fish allergic children in Spain, 15% of them showed symptoms with skin contact. The reactions appeared within a few minutes on them. And the important thing that 60% of them have atopic dermatitis. The fence, the skin is broken, so easy access in a highly allergic person can happen. And then about 60% them occurred even after indirect contact, meaning a person just touched a napkin that somebody else wiped the fingers with, the fork was dipped in fish, then dipped in a chicken, or the fingers of a person just eating, then caught the child, touched their skin. And in these children, the manifestations by skin contact, again, urticarial or angioedema, that will be the majority of them, local itching, erythema, and some, but sometimes urticaria and the wheezing, meaning systemic, that can mount up to anaphylaxis by touching. Another series of 27 subjects have allergy to asparagus by ingestion or handling. The IgE-mediated reactions were in 17, and allergic contact dermatitis, which is delayed, in 8. And the 2 of them have both conditions. Of the 19 with the IgE-mediated, the 17 and the 2, of these 19, 10 had contact urticaria, and 5 of whom had also respiratory symptoms. Even touching can affect the respiratory tract. Now, this is a story of 2 boys in Canada. Allergists there encountered them. They were allergic to peanuts, and they were getting trouble, urticaria and facial angioedema after they playing or while they are playing basketball. Until they told the whole team, if you ate peanut butter or touched peanut, wash your hands very well, and let us wash the ball also before we play. And nothing happened after that to their children. Even a very indirect reaction can happen. It can be very puzzling. Frequently, we work in our specialty as police detectives, and we enjoy it. And this child was raised very well, breastfed exclusively or nothing else for 5 months, and total for 18 months, a very commendable practice, but very strong history of allergy in the family. At 5 months, had anaphylaxis for a few milliliters of milk formula. At 6 months, had urticaria to egg soy, so highly allergic. And I start to see him at 17 months. IgE was very high in the sky. IgE is the general thermometer of atopy. And specific IgE, or so-called RAST, is very strongly positive to milk as well as other few foods. And I told the family that milk allergy is much easier to be outgrown than peanuts or tree nuts or fish or said fish. So I'm very optimistic that milk allergy will be outgrown. But since he's highly allergic, it will take longer time than usual. At 4 years, got urticaria, upper respiratory symptoms, while in a bathtub into which a few drops of milk were spilled from that cup with the hole in it near them. A few drops of milk in a tub can cause this. That this makes sense. Don't we need to send this mother to psychiatrist? Think. Would you believe her? And this case from Italy, an infant was exclusively breastfed for 6 months, good practice. And there was no family history of allergy. At 2 years, had recurrent acute bronchospasm after eating any cow milk product. And at 16 years, 3 minutes after a drop of milk accidentally fell on his skin, anaphylaxis occurred. Fortunately, there was a doctor there in the setting. At 16 years, after all these years, and 1 drop, oh no. By the way, I told Kathy to close the door so that you don't leave when you hear these funny things from me today. Because people say, I'm not going to waste my time to tell me a drop of milk on a 16-year-old person got anaphylaxis. Yes, let us remember that the book was written according to the patient. The patient does not read the book before he comes to us. That's by careful observation and good clinicians, case after case, until series become accumulated, that the science is made. And we frequently say, why did this patient didn't read the book before? Or we say, I never heard about this. I never read about this, because we did not attend lectures, or we know, am I going to waste my time to hear about food allergy? That's so simple. So I'm not going, I do better something else. Or we'll see articles about food allergy. Oh no. Well, I know a person's going to eat the food or vomit it, they know it. And we don't realize these serious patients. I encountered 5 young children who had severe food allergy from trivial skin contact, not a major thing. All of them were breastfed exclusively. These cases, just when I encountered them, gosh, you're breastfed very well and you have good parents delayed introduction of food. Why did you behave like that? You know, just like we say, this girl, her father is a Baptist minister. Why is she doing this? But the whole town will hear about her misbehavior because she is a daughter of a Baptist minister. So here a breastfed baby, and you get these severe, worse reactions. And these 5 children, by skin contact, 3 of them milk and 3 of them to peanut, by touching, by kissing, to that when the parent will kiss them after eating ice cream or drink milk, or even by smell of the peanuts or shrimp. Well, shrimp I understand, or we understand more because they smell strongly, particularly when they are boiled or fried. But peanut, do you smell much of it? Yes, that's what made many people ask the airlines, don't serve peanuts. And people say, don't serve peanuts in all schools either. Why? Because some people from smell. If I smell something, meaning particles of that thing touched my body, and the olfactory nerve endings felt it, otherwise will not. Do we see it? We don't, but we don't see viruses that kill people either. We don't see it even by ordinary microscope. Well, there's interesting 2 case reports. A baby, both of them present the same way. The baby was carried to the emergency room with anaphylaxis. They asked the mother what was doing. She said, nothing. Does he have any allergies? Yes. He has allergy to milk, but I am avoiding everything that has any milk product. And I didn't do that. Anyway, resuscitated the baby, and for fear of a second phase, biphasic reactions can happen, they admitted the baby to the hospital. And nothing happened. Next morning said, all right, the baby is fine. I don't know what was the cause. And while she was preparing the baby in the hospital, the baby had anaphylaxis. So what were you doing? She said, I'm just putting the diaper cream on him. Is that what you did yesterday? Yes. Oh, so a diaper cream caused anaphylaxis in a child. What was in that cream? Cod liver oil, vitamins, that's good stuff, zinc. Calcium also contains calcium caseinate. Wow. And this can cause, yes, on an inflamed diaper area, absorption can happen in a highly allergic person and get anaphylaxis inside the hospital. Well, how did they discover that? It was not easy because the tube was within the hand of the mother. So let us see the tube. The tube contains cod liver and so on. So where is the word caseinate here? The tube is here, doctor. So you read the label, and the label does not have it. Who keeps the paper package? Immediately throw in the trash. And keep the tube under the poor labeling that can have hidden things without knowing. Well, how much caseinate was there in that diaper cream? 5% of all these agents. Whereas another one that can be used also for diaper rash does not have milk products, and used it and no problem at all. There are many preparations, particular dermatologic preparations that have foods. And these are just examples of that. The people, these are 6 infants who have allergy to topical agents, can be wheat or milk or peanuts or egg, and various topical medications. And also for women, have a look at the shower gel that can have wheat, shampoo can have wheat, and the mascara, And foundation cream have sesame. Sesame is growing up more and more, being used now. Sesame seed problems in the United States. And that. But various preparations in medicine, whether it is medication for skin or cosmetics, can have some food products. Dental products can have milk or wheat or nuts. So here, put something in the teeth and oral mucosa easily absorbs these things. Well, this is also a very interesting case. This unfortunate person, starting by having anaphylaxis at 5 months on the first oral exposure to potato, very little mashed potato. Later got localized urticaria angioedema upon skin contact with raw potato. Got respiratory symptoms on smelling cooking potatoes. Got wheezing in walking on potato fields during its pollen season. This report came from Spain. And mild systemic reaction on going to stores of potato or ingesting minute quantities of hidden potato. Where will these minute quantities be in? Can be in yogurt, cheese, or cured meat. Well, do people know that? Are the labels showing these things always? And this will cause dilemma and diagnostic problem. This child was 6 years old when I start to see him. He has aeroallergens, had anaphylaxis since the age of 18 on eating egg, fish, and seafood. He liked to go fishing with his father. So it's not a psychological reaction. He wanted to go to fish with his father. But he got urticaria on touching egg or shrimp when one episode occurred in fishing trip within a few minutes of catching a fish. And what's worse, at another episode happened while he's in a room next to the kitchen and the mother was cooking with egg, breaking eggs, and he's not aware. Can we believe that? Even we cannot easily smell the egg when it is broken there. But either we listen to our patients and prove it scientifically in a blind fashion way so that we can make valid science. When I tested this child, I did not dare to use the regular extract, which are 1 in 10 concentration, but I have to dilute the extract to 1 in 1,000 to 2,000 so that I don't cause a severe reaction in that person. And most allergists will not even dare to touch that child with any diluted extract. Well, milk kids, I think 2 years ago, I gave a lengthy talk about allergy to romance here in this room. I'll not go in much detail. People remember it much more than any other presentations, I think. This 9-month-old was breastfed again for 7 months, exclusively for 5 months, and started to supplement afterwards. Strong family history of allergy. At 1 month, developed atopic dermatitis. At 3 months, localized urticaria following a kiss by his mother, who just ate cereals with milk. At 9 months, generalized urticaria when he was touched by his brother, who just ate a peanut butter sandwich. So these minute, trivial contacts. In a telephone survey of almost 400 persons, 20 of them, they are self-reporting, it's a survey, experienced reaction through kissing. 20 of them were contacted for more details, and 17 answered. All had local reaction on the site of kissing. 4 had wheezing. What kind of kiss is that? Kiss of death. And 1 systemic anaphylaxis. What a terrible thing. 4 had reactions even after persons brushed teeth. So even brushing the teeth and rinsing the mouth may still leave some particles. And the body can react to these minute particles, just react like reacting to an infectious agent. The immune system reacts vigorously to it. And some patients, after they brush the teeth and rinsed the mouth by a few hours, the case was offending. Found out some studies that after the food become absorbed and go through the circulation, some incompletely digested particles, large peptides, can be excreted in body fluids, including the saliva. So a new crop comes later. Again, peanuts and tree nuts are the most problematic. Number 2 entry or route is the mucous membranes, other than by eating. And that can be touching the mucous membranes, passionate kissing, can be through the nasal mucosa, or the rectal mucosa, or the vaginal mucosa. And there are many medications and things can go there. This baby is the son of a physician who was in our institution. He moved now, and the mother is a veterinarian. They're exclusive breastfed. Again, those good children that are supposed to be wonderful, when they react vigorously, go out of line. Following chewing on a wrap of rice cake. He didn't eat rice, chewing a wrap. Within 30 minutes had projectile vomiting for 2 hours with pallor and lethargy. He got shocked. That is the food protein-induced enterocolitis that many physicians, including pediatricians, are not aware of. It resembles IgE-mediated reactions, looks like an IgE-mediated immediate type, but it does not happen in minutes. It takes about half an hour to a few hours to start the symptoms. Several hours later had diarrhea. He was rehydrated because that's a shock. The parents did that on their own, and symptoms resolved in 72 hours, and had no previous exposure to rice products at all. And this tells us then how was sensitized. And this is the role of transplacental or transmammary. And many parents say, I never gave him that thing before. This is even not food. This is the paper, a wrap, a cellophane paper of that. And that's a report about a nasal drops that has lysozyme as a preservative, and lysozyme is source is usually egg. It can be from soy as well, and the person got a reaction from the drops, and was proven very well documented. Another preparation that has lysozyme, but it was vaginal suppositories, and there are in 7 patients repeatedly react to vaginal suppositories containing antibiotics and lysozyme, but evaluation showed that the antibiotics and the antifungal was not the problem. It was the lysozyme and exactly the ovomucoid in it. A young lady with chronic GI symptoms for 8 months, has atopic constitution as well, including to latex. She needed evaluation of her GI problem. She went to barium enema, but got anaphylaxis. What a terrible thing to the gastroenterologist there. The latex was suspected, of course, but the procedure did not involve any latex, and many hospitals, many doctors now eliminated the natural rubber latex to avoid this problem. Skin prick tests with each of the 13, so they looked what was in that barium enema cellulose material. There were 13 components. They got it from the company. It needs an effort to evaluate these patients. Was positive only to one component of the 13, that was sodium carrageenan. A serum was positive for carrageenan, was made, custom made for that patient. And skin prick tests with commercial carrageenan gum extract showed only very slightly. Interestingly, this incident or accident cured her. Her chronic GI symptom disappeared following avoidance of carrageenan containing products. And the GI symptoms were originally gone by that incident. 53-year-old female with severe arthritis. This is a very rare to have food-induced type 3 reaction. And she was experiencing arthritis flare-ups several hours after eating things with milk, because it's not an IG mediated, it's an immune complex disease. Arthritis always flared up on the morning after intercourse if her husband had ingested milk, unless he used condom. Third route is smelling the food, which can be occupational or sporadic. And by inhalation, it may cause respiratory symptoms, the first target organ that goes to, or even go to the skin that did not touch the food, or getting anaphylaxis. A man with upper respiratory symptoms for many years related to his job mixing minced meat with the spices and casein. At the age of 49, he experienced ocular itching, cough, and wheezing at work following setting up a kneading machine in an adjacent room. Very little exposure. Skin testing was negative to allergens. Skin prick test and specific IG in the serum were positive to casein and lactalbumin, both of them milk proteins. And bronchial challenge with powdered caseinate and versus placebo on different days caused drop. The casein, but not the lactose, caused about 40% drop. And here is the reaction, the placebo. The FEV1 did not change. And the caseinate powder, just by moving in a tray in front of the person, just caused almost 40% drop at dangerous level. And a large number of patients were evaluated for self-reported allergy, claimed reactions to food without eating it were in 17 when staying in the kitchen, and 13% in sitting beside a person who is sitting the offending food, 12% when close physical contact by kissing. I think that's too much close, to be close then. But to be even sitting at the table, I have two friends, professors. When we were eating in a restaurant, and we were about 8 people, the wife of, she's a professor also, said, "Sami, can you switch with me the seat?" Because her husband ordered fish, and she could not be just next to him in that. And a series in Spain, in the same series that I presented before about the fish allergic children, 11% of them have problems to the smell, particularly when it is fumes. 9 respiratory only, 9 cutaneous only, and 3 both systemic anaphylaxis. That there was a report several years ago about a person died in a restaurant in San Francisco on the Fisherman's Wharf. The Japanese restaurant cooked the meal nearby that person. It's not for that, but just cooking it there, and smells good, and the flames was wonderful, but the person got laryngeal angioedema, bronchospasm, died from them. So these patients who are highly allergic should be very, very cautious for exposure. And this is also very interesting. A child will getting rhinoconjunctivitis and the wheezing in the classroom only. The school chalk contained casein because casein absorbs very tight to the chalk material, and when they write it, it doesn't go in the air much in that. No recurrence after avoidance of that type of a chalk. 13 additional milk allergic children were evaluated. Testing with the casein-containing chalk was positive in 5 out of the 12. So even just little casein in the choke in the air will cause trouble, although the choke did not go in the air much. Yeah. Well, a farmer on a milk-free diet for many years because of GI milk allergy. While milking the sheep, he had severe difficulty in breathing and loss of consciousness. He received mouth-to-mouth resuscitation, recovered in 40 minutes. Diagnosis was nervous disorder. Send him to a psychiatrist. Well, meaning a person gets this problem every now and then. Had 6 recurrences all while was milking, with recovery by the time he arrives to the emergency room, the hospital there. So the exposure is gone, and the acute reaction abated. So he needs a psychiatrist. Well, he has a friend who has asthma. Told him, listen, you look like when I get an asthma attack. Why don't you use this inhaler? Let us try it. And wow, he used it, and the bronchospasm is gone. And that. I think I already presented that case, right? And oh, there's a repetition. Yes, regarding inhalation, when they asked people if they got reaction to peanut in the planes and flights, yeah, by inhalation can happen in that. But I wondered about those by ingestion, because by the survey, they found some of these, they know in advance they are allergic to peanuts. Why are you eating it? I can understand somebody eating near you, but why are you eating it? Then you say, I'm getting reaction in the flight. Many of our patients don't follow our advices. Whereas people call for banning peanuts in all schools, the allergist offices are full of patients are not following the advice of avoiding food for a child in the family. And we ask, are you avoiding that food? She looks down and says, I'm doing my best. Meaning, don't talk anymore about it. Don't question me. I have multiple children and I am working. Okay? So if a parents cannot avoid for a single child, why do we expect in multitudes and thousands in school that will avoid that for them? Oh, that's getting better. An 8-year-old boy with severe milk allergy and persistent asthma who needed a combination of inhaled steroids with a long-acting beta agonist and was avoiding strict milk. After several months, he obtained a new refill, a new batch of the same medicine. Upon using the new discus, he had immediate chest tightness that recurred on 3 consecutive, every time used it for 3 times. The medicine is supposed to help him as the previous didn't make it worse. Well, look at the Advair label. There is lactose, and lactose is made of originating from milk, cow's milk. So this is more quantity by inhalation in an asthmatic who has a hyperreactive airway will get a problem. And they skin tested the person. The person is known to have allergy to milk anyway, very strong. Lactose causes strong positivity by skin test. And the one lot of the medicine was positive and another lot was not. So variation also in this. The histamine was positive and the negative control. Well, another preparation also formoterol, dry powder inhaler, contains lactose. These are medications for asthma, and they are causing trouble. Next week, we'll have a session and a national meeting called My Patient is Allergic to My Medications. And I am assigned the role of allergy to antihistamine. Another colleague from Harvard, she will speak about the inhaled asthma medications that can cause allergy. Spiriva, lactose. Well, I made this look to find what medications have lactose. Asthma medication, whether they are inhaled corticosteroids or long-acting beta-agonist bronchodilators, they have various quantities, or not indicated at all. What is the quantity? You just wrote that there is lactose. Injectable steroid, and I underline the 40 milligram per ml because that particular preparation has been the trouble and has a hefty quantity per 1 milligram. Other asthma medications, what's the leukotriene inhibitors. Atrovent can have something derived from soy or peanuts, so it is the PDR cautions and the package insert because it have lecithin that it should not be used in these patients. However, a preparation of Atrovent nebulization, not labeled to have a problem, caused anaphylaxis in a lady. Meaning, if the person is highly allergic, be paranoid, paranoid, paranoid. Don't trust except your mother, even sometimes don't, just so that you don't die. The fourth route is transmammary. I will not bore you with this because it is well known in pediatric practice, it's not a big deal, that breastfed infants can react to foods or medications taken by the mother and excreted by the mammary gland. Numerous studies showed that, and they can measure even the quantities from the time of ingestion of the food to the circulation, when the peak in the circulation, and then about 6 hours will be in the mammary gland. If there is no more ingestion of the same food and the breast milk was squeezed or fed, by next day is gone. So it is well established there. One example only of the children that I saw, 15 months old, breastfed for 3 months and total for 9 months. His mother ate a lot of peanuts during pregnancy and lactation. She loved to have the peanuts in front of her watching television. Allergy strong in the family. At 1 year, had facial angioedema after rubbing his face with his hand that was just contaminated with peanut butter from another child's hand. Look, second and third hands exposure. Kathy wants me to stop 10 minutes before. Kathy, will you let me complete my talk, please? Pardon me? Oh, the escape, all right. See, you're good. See, yeah, I'm not a chairman, Steve. All right. The fifth route is the trans-placental. There are many mothers said this is the first time I gave that child the food, taste of it, and got severe reaction. And say, well, were you breastfeeding? So we accuse excretion in the breast milk. No, I was not breastfeeding. I'm just giving just this formula only. The baby is young. And I just gave him a piece of bread that was on the surface, a little egg white to make the bread looks nice, and got a reaction. So where did that child get sensitization from? It has to be across the placenta. There are several proofs for that for prenatal food sensitization, either by detection of food allergen in the cord blood, detection of antibodies in the serum from the umbilical cord or from a newborn, or allergic reaction in infants to the very first postnatal exposure of the food. However, no documented case of allergic reaction in utero unless the baby tolerated it, the fetus tolerated inside, and we didn't know about it. By injection, contamination of hidden food protein in medications, transfusion of blood products containing the food protein Whatever we eat, some large peptides, incompletely digested, will go in the circulation and can go anywhere in the body. So this is an injectable corticosteroid. A report of 2 milk allergic children developed generalized urticaria following intramuscular dose of a particular formulation of solumedrol. Both of them had asthma, or one of them had asthma and one has urticaria, and they went there for treatment in the emergency room and got anaphylaxis, both of them from the solumedrol 40 milligram per ml. They were evaluated and they were tested to 5 injectable corticosteroid preparations. Both children reacted only the solumedrol of the 40 milligram per ml, but not solumedrol 125 milligram per ml. That does not have lactose. So the lactose content in that preparation, it has beta-lactoglobulin, a major allergen of milk there. Although it is called solumedrol, but 2 different strains have 2 different contaminations. Another report of 2 similar children with history of severe milk allergy presented to the emergency department with acute asthma exacerbation and anaphylaxis following intramuscular solumedrol, and both of them have the 40 milligram methylprednisolone in here, 40 milligram. Food, proteins, and vaccines. I think it has been ironed very well for many years that egg is not a problem from MMR. And in spite of talking for years, still, we see some practitioners say MMR is made in egg and that child is allergic to egg. And even it can be by the word by mouth of parents who are not true, and they deprive the child. First, the MMR is not made in egg. And I pose to be settled well. The measles and mumps are made on chick embryo tissue culture. Mean the chick embryo took the skin, cut it into pieces, grew into flat flask. Every day it changed the medium until we have a layer of tissue of cells, layer of cells, and then add the virus in it to reproduce and make vaccine of it. Where is the egg here? That's a tissue, became tissue. So it has been settled, and no child should be deprived from MMR because of that. Rubella is in human diploid cells anyway. But egg is present influenza vaccine, which has very minimal risk. I said the word very, although it's made in egg. But a few studies done recently that this quantity is so little that almost every person allergic to egg will have the influenza vaccine, which is very important. Gelatin is being present in many vaccines, almost in every vaccine, and it's a very rare risk. So to deprive people from important vaccinations because of suspected food allergy is unlikely. I get them, and I get them the vaccine and relieve the practitioner from being worried. A 6-year-old with ALL had anaphylaxis while receiving leukoreduced pooled Paficot cells with ABO identical platelets. During that episode, tryptase was drawn, which is a mast cell mediator released on anaphylaxis there, and found very high. Well, investigated whether he has antibodies in IgA deficient, but he had normal IgA, therefore no antibodies to IgA that cause anaphylaxis. It is not complement-mediated and does not have a problem with haptoglobin. No history of drug or latex allergy, but 5 years earlier had anaphylaxis to peanut, which was being avoided. Well, of course, at that time, who was going to care about treating ALL about the word of peanuts anyway? It's not, we are dealing with a lethal disease. Allergy is so simple don't take the history. And if you take the history, what I'm going to do, I'm giving him platelets. But you go retrospectively, call the blood donors who contributed to this pool, and found 3 of them recalled that were eating a large quantity of peanut the evening before donated blood. Again, some completely digested food will cross the GI mucosa and go in the circulation and even coats the platelets or any other cells. The 6th route and the last is through transplantation, either bone marrow or liver. There are several papers about the bone marrow. The time will not allow to go through them, but one. A woman with non-Hodgkin's lymphoma received bone marrow transplant from her HLA identical brother who has multiple allergies. 3 months later, she developed eczema, then allergy to banana, then oral allergy syndrome to avocado, then allergic rhinitis, all that. She did not have all that before, but she got it through the bone marrow. She inherited a new genetic constitution. Pre-bone marrow, the IgE was very normal. After the bone marrow became about almost 4 or 5 times more. And specific IgE antibodies was positive avocado and banana that caused trouble later on, but was negative in the serum that has before the bone marrow transplant. Liver transplant. Liver is a very good hematopoietic organ. It is the origin of hematopoiesis in the fetus, and in the newborn has a great role. So organs were procured from a young man who had fatal anaphylaxis to peanuts. His liver and right kidney, let me give you the graph to save time. So they procured the organs, and the liver and the kidney gave it to a person, a man. The pancreas and the other kidney were given to other woman. And that man later on developed peanut allergy. The woman did not. Followed for a long time. Looking at the man's, the peanut allergy, peanut specific IgE, in vitro basophil degranulation to peanut antigen, and peripheral chimerism showing that different, the 2 cell lines are there, took the 2 genetic. While the woman, no problem at all, because the pancreas and the kidney does not have the hematopoietic ability. So in conclusion, food allergy can occur without eating. And probably it is much more than we realize, because we have to ask a person, what did you do before you got this reaction? And the person say, I didn't eat, so food will not be suspected. But skin contact can be a problem. Mucosal contact, whether diagnostic or therapeutic or a passionate kiss. Smell, particularly heated foods, they boiled or fried. Transmemory or by injection, even by corticosteroids, the treatment of anaphylaxis. Even by bronchodilators, the treatment of asthma or transplantation. And again, I remind you with this, we are dismissing frequent because I never heard about that. I never read about that. Therefore, the patient is wrong. Go read the book and come back to us. Whereas by good observations, even by cases that some colleagues say, you are talking about individual cases. Science starts with individual cases. And by observation, by believing, accumulating more, and observe more. Thank you. Any questions? Yes, Patrick, please.
I just want to ask a question, which really mainly to show my ignorance of this. In the trans-placental, if there's effector cells that are being set up to give the infant, the newborn infant, anaphylaxis, the urticaria, how long will those cells also circulate in the mother, and why wouldn't the mother show similar reactions since she shares blood with that fetus during gestation?
Actually, what crosses the placenta is not cells. It is the antigen itself, which is much easier to cross the placenta. The fetus makes its own cells by the genetic from the mother and the father, and that. So it is the antigen that crossed. And sensitized, if the fetus had genetic predisposition, will be sensitized. The T cells develop very early, and there is evidence that they can be sensitized early as 12 weeks of gestation, very early. Of course, the later in pregnancy, particularly during the third trimester, the worse will become.
Thank you.
Good. Yes?
Does this transference of allergy happen with other modes of transplant besides bone marrow transplant?
The bone marrow transplant transmits the genetic. You are giving a new immune system with whatever in it, genetics in there. The liver, you are getting the hematopoietic, the stem cell in it that can also develop in there. But as you saw, the kidney and the pancreas not. The skin, I don't think so. I don't think in other organs. It just you need hematopoietic, and these are the two main organs. Okay, thank you.